family where we are 5 sisters. I'm the youngest one. Despite of being raised in a similar environment, same meals day in and day out, having the same genetic pool, in midst of that familial diversity, I was the skinny one. You all can see that till date, right? And I remember in my preteen years, every day, without fail, some or the other relative had to ask me, "Mummy, kuch khane ko nahi deti hai?" Right? Or your mother doesn't feed you or what, right? And you know how those adolescent years are. We are all about fitting in the world. We are all about body image. And you know, I used to wonder, why me? It was like I had a serious pact with my meals. No weight gain, no, not happening, right? But then a very interesting twist occurred. When my sisters were growing up in their teenage years and things like that, they started to watch anything and everything that they were eating, right? And I still remember their sentences saying, whatever we eat, it's fattening, and if Pariksha is sitting down and finishing a tub of butter, needle on the weighing scale still won't move. Nope. And that's where the curiosity started to kick in, and I started questioning that intriguing part where there is such amazing individual differences the way we all digest and absorb food, right? So if I give you same kind of food, none of us is going to metabolize it in a similar fashion, even if we come from the same family, right? And that's where I realized that calories in, calories out doesn't work, right? So the whole fundamental that I was studying in my 10th grade, 12th grade, that, you know, high calories is going to lead to weight gain, negative calorie balance is about weight loss. No, not true. Not for everybody, at least, right? And that's where, you know, when I was growing up, I suddenly started developing these weird headaches when I was in my 12th grade. And they were very irritating because every now and then they used to come like a migraine and the doctors were treating me. None of the medication was working. And the more medication I took, it led to a lot of stomach problems for me. And then I thought, let me wear the detective's hat and do something about it. So with few tricks up my sleeve, and with a couple of things that I read online that I had to keep a food diary, I kind of cracked the code. So whenever I was eating sugar or sugar-loaded beverages, that's where I used to get headaches, which were, you know, perceived as migraines. The moment I kicked the sugar to the curb, my headaches were gone, vanished magically, right? That slight little victory actually gave me the sense of purpose that food can be medicine, right? And that's where I started studying nutrition, right? And if you look back today, I'm sure all of you can think of a lot of things that happened in your childhood that you still relate that I could have changed and would have had a better lifestyle today, right? And by the time I made a decision that I need to go to Delhi, study nutrition, you know, there was quite a bit of research that was coming out and we were falling prey to every kind of diet, right? How many of us follow keto? Atkins, right? The paleo? Every time you know, wave arises in the West and settles in East Asia, right? And we are just following it. So after finishing my studies, I started my internship, right? I worked at AIIMS for some time. And in AIIMS, we used to go in IPD settings, OPD settings, everything, right? And seeing my patients recover faster with the therapeutic nutrition solutions that I was putting, it was really a very huge sense of fulfillment for me. And that's where I realized that, you know, nutrition is the field for me and made peace with it. Then in OPD setting, we used to see about 50 to 100 patients in a day. That's about average 3 minutes per patient, right? And it was a regular day, regular routine, sitting in OPD, counseling patients. And suddenly a gentleman walks in and he starts to shower his blessings. I was really happy when, you know, in that day and age, we never used to get a lot of, you know, appreciation, especially sitting in a government setup, right? And I requested the gentleman that please wait. I would like to talk to you in detail. And of course, thank you for this gesture. The moment I sat down with him, and I started talking to him that, you know, what exactly did you do that, you know, you're showering your blessings on me? So he said, whatever nutrition plan you had given me has really helped, right? And I was like, okay, tell me, what did you eat? What was the plan that I gave you? So I still remember those were, you know, plans where we tear out a leaflet from a booklet. I'm sure in some part of your life, you would have experienced a dietitian giving you those plans, 2 roti, 1 sabzi, 1 dal, right? I'm sure that will be there in someone's fridge today also at home, improving the aesthetics of their kitchen, right? Because they can't be complied to, right? Anyway, so the moment I started to get into deeper details, the gentleman answered whatever you had written on that sheet, right? And I saw the sheet, he brought it back, and that prescription was given 8 months back. So just to explain it to him that, you know, instead of dal, you can have a moong dal. For a sabzi, you can have peas, carrot sabzi, or something like that I had written. 2 chapati, 1 katori rice, and the whole jargon was there. So what did you have throughout the 8 months? He said, exactly what you had written down. Imagine my plight. The gentleman had eaten moong dal, gajar ka sabzi, 2 chapati for his breakfast, lunch and dinner. That was like a metaphorical slap on my face in that moment, and I realized one-size-fits-all approach is not nutrition, right? It's wrong, correct? So when I sit back and I think how we all are different, right? We have these unique personalities. We are me, I am me, right? Same ways our bodies are very, very different. So the one-size-fits-all approach has to be left behind and move along with the science of nutrition. So eventually, when I was working in hospitals, we understood that why the mortality rate is transitioning from malaria and infectious diseases to food-related diseases or lifestyle-related diseases, right? We were earlier dying because we had infections around us. Now we are dying because of the food that we are putting on our plates or the physical activity that we are missing, right? And that's where it made me realize I have a higher responsibility to make a difference, bring functional nutrition and personalized nutrition into the mainstream and help people live a healthier, longer life. So I worked with public health sector, then I worked with a pharma sector. I wanted to understand how the entire healthcare sector works, right? In that experience, 2 decades, I counseled approximately 2 lakh plus patients. Every time I'm sitting and counseling a person, and I tell them, today it's time for you to let go of your sweets, right? Imagine if I tell you, tonight when you go back home, instead of snacking on burgers, pizzas, and popcorn when you're binge watching Netflix, snack on apples and oranges. How does it feel? Right? Doesn't feel right. Doesn't feel fun. It's so boring. But who set this food as a reward that correlates to fun for us? But today, if I tell you to make a change, you feel in a state of denial. No, I don't have any problem, right? And that's what most of my patients told me. I don't have diabetes. I don't have hypertension. It's a temporary thing. It's going to go, right? Or the feeling of deprivation. So when they are walking out of my OPD room, I see swollen faces, sulking hearts, sinking hearts. Oh God, I have to leave my rasgulla. I have to let go of my gulab jamun, right? How many of you are ready to let go of that? Or my favorite chocolates, right? So that's what I'm saying. Even if you think of letting go of your habits, it's so depriving in nature. And I didn't want to do that, right? That's where I thought there has to be something better. I'm just fighting the fire by telling people what to do when the damage in the body has already happened. And that's where I started NUI. NUI is a personalized nutrition platform where we understand a child's nutrition needs very early. And I agree with Mr. Anand here. Early childhood micronutrient problems is the culprit today for all the diseases that we are dealing with, right? So there is a massive study that we did that how the iron levels, low iron or hemoglobin levels is leading to adult-related liver disease, fatty liver disease. And in India today, 70% of us are reported to have fatty liver disease. And that's coming from our childhood, right? So we have to do something about it, isn't it? And that's where me and my team came together. We set up a pediatric setup where we wanted to take care of weans to teens and everybody in between, right? And that's where the story of NUI started. But what is precision nutrition and why I'm focusing on that? Like I said, I have a certain genetic makeup. I live in a certain environment. Now I'm in Bangalore. I have certain eating habits, and I have a certain way my bacteria in my tummy digest or absorbs food, right? The science of providing that particular nutrition plan is precision nutrition, right? Now, the biggest thing that was happening to me, people were coming to my OPD and they were talking about, can I do a FMT transplant? I was like, what is that? And it is 8 years back I'm talking about, right? Anybody has heard your FMT transplant? Yeah, so it's good that it's making some sense here in this conversation. So it was a fecal medical transplant, and I was like, why? It's gross, where did it come from? And that's when 8 years back I started studying about that we human beings are more single cell organisms that comprises and makes us us rather than the human flesh, right? So the trillions of bacteria that we host inside our gut, that's where we become individuals when it comes to developing a disease, suppressing a disease, or digesting a particular food, right? So there is good, bad, and the ugly bacteria that is setting the tone, right? So these roots of health are set very early in life. So a child, when they are in mother's womb, that's where the immunity starts developing, and we are talking about post-COVID immunity and nutrition plans, right? The 80% of work is done back then. 20% is today in your hand, right? So what can we do as adults? We can understand that, okay, if I did not eat healthier earlier, maybe it's high time that I start making healthier choices. And believe me, nutrition is very simple. When I say ethnicity at play, right? A person who comes from Kerala digests coconut oil very well, right? But a person who comes from North, if I keep eating coconut oil, my body is not going to utilize that good fat in coconut oil the way a Keralite would. Just an example, right? And we see it in our clinic day in and day out, right? So the traditional eating, where you were born and brought up, the soil or the vegetables that you ate from the local markets, that's what formed our gut microbiome in the initial years, and that's what gives us immunity, health, vitality, whichever way, and for that matter, mental well-being today, right? And imagine the way we utilize our medication, right? So precision nutrition is a field that comes from precision medicine, right? It has been tried, tested for at least 5-6 decades now, it works wonders, right? So there's this person and this family comes in and the daughter is struggling with the father's blood sugar levels. And she's like, Pariksha, nothing is moving. I am giving the exact diet you have written down. The carbohydrate counting is done very well, but still his blood sugars are very, very high, and I'm worried it could lead to a lot of complications. So we look at the plan, we work together, I set another plan in place, and I say, okay, let's give it another 10 days. But his blood sugars are very, very high, and he has reached the maximum amount of insulin, right? The doctor has said, I can't give you any more insulin. Nothing is happening in your body. Either you stop eating, or you just walk all day long, right? And I still remember Mr. Karthik, and he just came back and said, Pariksha, I'm doing everything that you've asked me for. And the next day, daughter comes back, sits with me and says, my father is a big sweet tooth. I'm 100% sure when I go out to work, he sits and eats all the sweets, right? And I mean, you try to listen to the family member, right? They're trying to take care of their loved ones. I also kind of got along and I said, okay, let me counsel again and I'll try and see what kind of difference I can make. So nothing happened. 15 days, same story, and I was really worried that those sugar level is going to do a lot of damage to brain, heart, muscles, whatever. And then the daughter went and installed a hidden camera when she goes off to work to see what father is eating throughout the day. And to our surprise, he's eating exactly what has been written down, the way carbohydrates have been counted, the amount of insulin is fine, insulin dosage is fine, everything is good. Then what is happening, right? That was a real head scratcher, correct? Then we put some other tests into picture and started understanding that that gentleman metabolizes or uses insulin far, far, far higher quantities than you and I can ever do. So his gut microbiome or his kidneys are clearing insulin much faster and his sugar levels are very, very high. Just by understanding that fact, we worked with the doctor, we sat down, and the person who was getting at the verge of getting dialysis done or a kidney failure done, we could understand that the body is using insulin very fast, and we started putting some exercise plan and reduced his carbohydrate further, and at least we prevented him from going into renal failure. That's the power of nutrition, and that's the power of precision nutrition that we need to take forward for the coming generations. So like I said, if I give everybody the same amount of bread, everybody will have a different response. So one man's portion can become other man's poison fairly very easily, right? And the kind of food that we have been eating day in and day out, that's what matters, right? So remember to stay close to your roots. Eat the way your great-grandparents ate. Remember the soil that you were born and brought up in. Those are the local foods that are going to do amazing health benefits to you, not sitting in Bangalore trying to eat kiwi that has been imported from US, right? Doesn't work. We need local amla. We need local santra, right? That's where our gut will get stronger. That's where our gut lining will become stronger, and that's where I see a lot of response. So there is quite a bit of studies that are going around, and there's this person who comes and manages that, Pariksha, for hypertension, you have cut down my fat intake. Poor thing was on a low-fat diet, very happy to follow the diet. And then again, his blood sugar levels and the fatty acid levels were increasing. Apparently, he was a person who had a genetic variability, where if I give him a low-fat diet with his hypertension, one thing is high blood pressure was becoming bad. On the other hand, his triglycerides were becoming bad. So that's where understanding an individual body type makes a difference, right? So we all are different. I respect that differences in our culture, in our tradition. Simply just try and follow what our great-grandparents ate and the soils that we come from. Yeah. So for my family, I generally like to practice the traditional way as well as advanced nutrition science, because all said and done, I'm a big fan for the way we Indians eat. It's a perfect balance of prebiotic, probiotic, whatever you can hear the jargon around, right? Amazing food concept. But we are experts at burning our nutrition also, right? Jala jala ke khana banate hain, correct? So make sure that we try and cook the food in the right way, right? Try and incorporate all your chutneys, pickles, keep an eye on your sodium intake, right? And the traditionally chutneys that are made in our house, that are wonderful for our gut health, right? Today's Lodi, happy Lodi to you all, wish you Pongal. Why do you think we eat jaggery and sesame seed at a particular day and starting the year? There is a reason, right? The weather is changing. Your body needs to build that kind of immunity. Your body needs that warmth. And that's why, the traditions are set. Correct? Yeah, to complement, bring advanced nutrition science and throw in some chia seeds as well, right? So a combination of Ayurveda, our traditions, and the advanced human nutrition is the recipe for success when it comes to healthcare, right? And generally we think or carried away that eggs are bad, they lead to cholesterol problems. No, nothing of that is true, right? Don't overcook your paneer, the paneer gravy and the favorite Bangalore paneer butter masala gravy. The protein is gone, it's overcooked, it's dead, nothing is there, just the flavor, right? So just make sure these small things we can incorporate in our daily eating pattern, and whatever possible ways you can incorporate nutrition in your daily diet, that's most important. Yes, and if you have children around you, families who are raising children, just make sure that they raise the next generation really right with the right choices. I generally prefer the food that I am born and brought up eating, right, which is like roti, sabzi, dal and everything. Only one change that I suggest and I make in my daily diet is to change the carb portion to a protein and a fiber portion. So I only reduce a chapati, I increase the vegetable and the fiber, so that fiber will help my protecting my cells, antioxidant, whatever, and the protein which is missing in Indian diet. So just a small swap from a traditional eating till date, that will help us. And why our great-grandfathers needed that rice, that had a reason. They used to burn it out in fields, right? We are sitting. So we need to reduce that and get to a healthier eating pattern. So that's the small swap to Indian traditional diet that we can make and actually get to good health. Yeah, so the idea is, let's just join hands. We are tired of seeing 35 million people dealing with diabetes, cancer, heart disease. Let's try and make an impact with preventive health rather than just popping in pills later, right? So let's improve the health quotient of a country one meal at a time and join hands in this movement of improving our nation's next generation. Thank you so much.